Your cat could be seriously ill right now, and you might have no idea. Cats are masters at hiding pain and sickness, and by the time most owners notice something's wrong, the disease has often progressed to a critical stage. Today, I'm revealing the 7 subtle signs that your cat is sick. Signs that are so easy to miss that even experienced cat owners overlook them. These aren't obvious symptoms like vomiting or limping. These are the quiet, sneaky changes that happen days or weeks before a cat becomes obviously ill. One of these signs, number 5, is so commonly ignored that it's responsible for late-stage diagnosis in thousands of cats every year. Let's get into it. Why cats hide illness. Before we dive into the signs, you need to understand why cats are so good at hiding sickness. In the wild, showing weakness makes an animal vulnerable to predators and competitors. Cats evolved to mask pain and illness as a survival mechanism. A sick cat in nature becomes easy prey, so natural selection favored cats who could hide their symptoms. Your domestic cat still carries these instincts. Even though they're safe in your home, their biology tells them to hide vulnerability at all costs. This creates a serious problem for cat owners. By the time your cat shows obvious signs of illness like not eating, hiding constantly, or visible lethargy, they're often critically ill. The disease has progressed far beyond early stages. The key to catching illness early is recognizing the subtle changes that happen before obvious symptoms appear. These are the whisper signs that tell you something's wrong, while there's still time to intervene effectively. Sign number 1. Changes in litter box behavior. The first and most important sign is changes in litter box habits, and I'm not just talking about accidents outside the box. Watch for these subtle shifts. Your cat is using the litter box more frequently but producing small amounts of urine. This can indicate urinary tract infection, bladder stones, or even diabetes. Straining or spending more time in the box. If your cat sits in the litter box longer than usual or appears to be straining, this could signal constipation, urinary blockage, or gastrointestinal issues. Changes in stool consistency or color. Diarrhea is obvious, but softer stools, unusual colors, or blood traces are early warning signs of digestive problems, parasites, or more serious conditions. More or less frequent urination. Both extremes matter. Increased urination can indicate diabetes or kidney disease. Decreased urination might mean dehydration or kidney problems. Here's why this matters so much. Urinary blockages in male cats can become life-threatening within 24 to 48 hours. Kidney disease caught early can be managed for years, but caught late becomes terminal quickly. The litter box is your diagnostic window into your cat's health. Clean it daily and pay attention to what you see. Changes in litter box behavior are often the first sign of serious illness. Sign number 2. Subtle weight changes. Weight loss or gain in cats often goes unnoticed because it happens gradually, and cats are covered in fur that hides body condition changes. Here's what to watch for. You can suddenly feel your cat's spine or ribs more prominently when petting them. This indicates weight loss that might not be visible. Their face looks thinner or more angular. Cheekbones becoming more prominent or the face appearing more hollow suggests weight loss. The opposite matters too. If your cat is gaining weight, you'll notice their belly hanging lower, difficulty grooming themselves, or reduced activity. Weight changes indicate numerous potential problems. Weight loss can signal hyperthyroidism, diabetes, kidney disease, cancer, or dental disease. Weight gain can indicate diabetes, hormonal imbalances, or decreased activity due to pain. The problem is that gradual weight change over weeks or months is hard to notice when you see your cat every day. This is why regular weigh-ins matter. Weigh your cat monthly at home or at your vet clinic. Record the weights. A loss or gain of just 5% of body weight is significant and warrants veterinary attention. For a 10-pound cat, that's only half a pound. Sign number 3. Changes in grooming habits. Cats are fastidious groomers under normal circumstances. Changes in grooming behavior, either increased or decreased, signal problems. Decreased grooming shows up as a dull, unkempt coat, mats forming in areas that used to stay smooth, or a greasy feeling to the fur. Cats stop grooming when they're in pain, feeling nauseous, are overweight, and can't reach certain areas, or are dealing with dental disease that makes grooming uncomfortable. Overgrooming is equally concerning. Bald patches, usually on the belly, legs, or back. Skin irritation, redness, or raw spots from excessive licking. This often indicates allergies, skin parasites, pain in the area being licked, or stress and anxiety. Here's what's tricky. Overgrooming can look like the cat is just being clean. But if you notice bald spots or your cat is constantly licking the same area, that's not normal grooming. That's a symptom. Dental disease deserves special mention because it's extremely common and often causes subtle grooming changes. Cats with painful teeth or gums may groom less because the act of licking hurts. They might also drool while grooming or avoid grooming their face entirely. Sign number 4, altered sleeping patterns. Cats sleep a lot naturally, 12 to 16 hours daily. But changes in where, how, and how much they sleep can indicate illness. Watch for sleeping more than usual, especially if they're hard to wake or seem lethargic when awake. Sleeping in unusual locations, particularly hiding in closets, under beds, or in dark spaces when they previously slept in open areas. Restless sleep where they can't seem to get comfortable, frequently changing positions or locations. Cats in pain often struggle to find comfortable positions. Arthritis makes it hard to settle, digestive issues cause discomfort when lying down, and respiratory problems make certain positions difficult. Hiding during sleep is a big red flag. Sick cats instinctively seek isolated, protected spaces. If your social cat suddenly starts sleeping in the back of closets or under furniture, take it seriously. The opposite also matters. If your usually independent cat suddenly becomes clingy and wants constant contact, this can indicate anxiety from not feeling well. Changes in sleep location or quality often precede more obvious symptoms by days or weeks. This is your early warning system. Sign number 5, subtle behavior changes. This is the sign most commonly missed, and it's critical. Subtle personality or behavior changes that seem minor but indicate your cat doesn't feel right. Watch for being slightly less interactive, not quite as interested in play or attention, but not obviously lethargic. Small changes in routine, like not greeting you at the door anymore, skipping their usual evening zoomies, or sleeping through dinner time. Increased irritability or decreased tolerance. A cat who used to enjoy being petted but now walks away sooner or seems annoyed faster may be uncomfortable. Withdrawal from other pets or family members. If your cat stops engaging with household members they previously interacted with, something's changed. These changes are subtle. Your cat isn't obviously sick, they're just slightly off. This is what makes this sign so dangerous. Most owners dismiss these changes as the cat having a bad day or getting older. But cats don't have bad days the way humans do, and age itself isn't a disease. If your cat's behavior changes, there's a reason, even if it seems minor. These subtle shifts often indicate pain, nausea, or general malaise in early stages of disease. Catching them early can make the difference between managing a condition and facing a crisis. Sign number 6, changes in drinking habits. Changes in water consumption are huge diagnostic clues that owners frequently miss because they don't closely monitor water intake. Increased water drinking is often the first sign of kidney disease, diabetes, or hyperthyroidism. You might notice the water bowl needs refilling more often, your cat is visiting the water bowl more frequently, or they're drinking from unusual sources like faucets or toilets when they never did before. Decreased water drinking can indicate nausea, oral pain, or early kidney disease, ironically. Cats who feel nauseous often avoid water, and dental disease makes drinking painful. Here's why this matters so much. Kidney disease is extremely common in older cats, affecting up to 30% of cats over 10 years old. Caught in early stages through blood work prompted by increased drinking, kidney disease can be managed for years. Caught late when the cat is obviously sick, the prognosis is much worse. The challenge is that monitoring water intake is difficult in multi-pet households or if your cat drinks from multiple sources. But if you can track it, changes in drinking habits provide invaluable early warning of major health problems. Sign number 7, Changes in vocalization. The final sign is changes in how much or how your cat vocalizes. This is subtle and easy to dismiss but can be significant. Watch for increased vocalization, especially at night. Cats with hyperthyroidism, cognitive dysfunction, or pain often become more vocal. Yowling or crying sounds that are new or different from their normal meowing. Changes in voice quality. A hoarse or raspy meow can indicate respiratory issues or laryngeal problems. A weak or quiet voice when they were previously loud might signal weakness or illness. Decreased vocalization. If your normally chatty cat becomes quiet, this can indicate they're not feeling well. Nighttime vocalization deserves special attention. Cats yowling at night, especially older cats, may have cognitive dysfunction, hyperthyroidism, high blood pressure, or unmanaged pain. The key is recognizing changes from your cat's normal baseline. Some cats are naturally vocal, others are quiet. What matters is deviation from their established pattern. What to do if you notice these signs? If you recognize any of these signs in your cat, here's what to do. Don't wait to see if it gets worse. With cats, obvious illness usually means advanced disease. Early intervention dramatically improves outcomes for almost every condition. Schedule a veterinary appointment promptly. Be specific about what you've noticed and when the changes started. Write down the symptoms before the appointment so you don't forget details. Keep a symptom diary for a few days before the vet visit if possible. Note eating, drinking, litter box habits, and behavior. This information helps your vet diagnose faster. Don't rely on Dr. Google to diagnose your cat. The same symptom can indicate dozens of different conditions. Professional evaluation with examination and often diagnostic testing is necessary. Blood work is crucial for cats over 7 years old, even if they seem healthy. Many serious conditions show up in blood work before symptoms appear. Annual or biannual wellness blood work catches problems early. Trust your instincts. You know your cat better than anyone. If something feels off, even if you can't articulate exactly what, that's worth investigating. Veterinarians take owner observations seriously. Cats are incredible at hiding illness, but they can't hide everything if you know what to look for. The subtle signs we discussed today are your early warning system. Pay attention to litter box changes, weight shifts, grooming habits, sleep patterns, behavior changes, drinking habits, and vocalization. These small changes tell you big things about your cat's health. The earlier you catch problems, the more treatable they are, and the better your cat's quality of life and prognosis. Thanks for watching. Subscribe for more evidence-based cat health content, and drop a comment telling me, has your cat ever shown subtle signs of illness that you almost missed? What tipped you off? Share your experiences below, because your story might help another cat owner recognize symptoms in their own cat.